your thumbs. For this one, your chest and your legs, you have to use your palm.
Fingers. Palms.
I-check lang muna because we have to palpate lang. For your spine is your thumb. Muna na. Ha? Identify any areas of tenderness, masses, and inflammation. And also, we should check and palpate the ribs for symmetry, mobility, and tenderness. For mobility, how could we check for the mobility of your spine?
Range of motion.
ROM. So, you ask your patient to
Flex. Flex. Bend.
Also, you can do this one for checking the mobility. Also, we check for the tenderness and
Pain.
of the spine or tenderness for the vertebral position. Next is assist for symmetrical chest expansion. So, the normal chest expansion is 5 centimeters. So, on chest expansion, we are considering your inhalation and exhalation. So, you should place warm hands on the posterolateral chest. So, you have to check ang pinaka-last ba ng ribs. So, din yung ikotang sa T9 or T10, so this one. So, dapat, ang duwa ka thumb is the only. Then, you ask your patient to breathe. Dapat i-expand na siya. So, bilang normal expansion?
5 centimeters.
Hindi naman siya dapat mag-back niya siya. Exhale, dapat kung ma-inhale, mag-back siya. So, the normal is 5. Next, access for tactile primitus or vibration of the chest wall created by speech or vocal sound. So, how can we check for the tactile primitus? Ma-check nyo.
Palpate.
Palpate. So, you ask your patient to breathe. You ask your patient to say 88 or blue moon.
99 ka na, miss.
Ay, 88.
99.
Nag-minus na si Miss. So, 99. Then, we should check for the vibration. For the tactile primitus, dapat nag-S ang inyo. So, ari-ari sa baba ang your scapula. Then, manaw ka mo for the second yung intercostal spaces. Now, kung dito mo ma-check, now sa dalawang, hindi magsaylo-saylo. So, you have to tell your patient to say 99. Then next, so we're checking on the intercostal spaces, not for the bone, because we're checking for the vibration. So, the intercostal spaces are 10 na di siya kabilog. Then, you have to check for the lateral also. Meron ka nakaroon video of that. So,
Ano, miss?
Grianay, scapula. Then, manaagri sa first yung intercostal spaces. Then, next is Gri. Ma-S ikaw, masayro ikaw sa pihak naman, then padalong, then Gri. Then padalong, then Gri. The-S ha, wala ka, X. So, kung Gri ka na una, madalong ka ng Gri. Then, Gri naman sa next, padalong, then Gri naman, padalong, then Gri sa pihak. Then, na siya. Then, for the lateral, 2 na siya kabilog.
Dapat ma-feel ang vibration.
Kagdalong. Then the other one, babaw, kagdalong. So, you're checking for the vibration. So, we're checking for the vibration of the chest wall created by speech or bawha. Dali ayun ha.
Kada moment, mambalay din ay.
Yes, because
Continuous lang, miss.
vibration, ha? So, 1, 2, then padalong. Wala kita nga, XX. So, S lang kita nga. Then you have to check for the lateral also. So, start at the back, scapulae. So, this one, under your knee. So, drin kita start. Then, padalong. Hasta sa atin nga, T3 to T10. Then, for the lateral. So, when you find C7, which is the vertebral prominence, and go to T3 in between the shoulder blades and spine. This will assess the right and left upper lobes.
During closer inspection, you may more clearly see skeletal abnormalities, scars, asymmetry of chest wall movements, or the swelling of subcutaneous emphysema. Are you in any pain or? No. This assesses for any rib trauma. If there is a fracture or bruise, the pain localizes to the affected area. If already done as part of examination of the anterior chest, it is not necessary to repeat here. This assesses symmetry of chest wall movement. Again. This assesses chest expansion. All the way. Thumbs should move symmetrically, and normal expansion is at least 5 centimeters. Your thumbs must meet at the moment of full expiration for an accurate assessment of chest expansion. Okay. Can I get you to put your arms around yourself as if you're hugging yourself? Okay. Can you repeat after me? Blue balloons. This rotates the scapulae out of the way. This assesses tactile firmness. Position the side of your hand in the intercostal spaces to maximize sensitivity. Firmness is increased over consolidation, local collapse, or solid masses. It is decreased over effusion.
Blue balloons. Blue balloons. Blue balloons. Blue balloons.
Blue
Blue balloons.
So now I'm going to tap again on your back. Percuss the posterior chest, starting with the supraclavicular fossa on the apex of the lung. Next, percuss the clavicle directly. Percuss in an S-shaped pattern, which compares left to right and upper zones to lower zones. If you have not already done so when examining the anterior chest, percuss 2 areas in the axilla.
For your lateral.
Now you listen to your breathing. So, you take some deep breaths in and out through your ventricles. Start by listening over the apices with the bell. Switch over to the diaphragm. Move in an S-shaped pattern so that right is compared to left and upper compared to lower regions. Listen over the same areas you percussed. The apices, 4 to 5 areas down the chest, and 2 areas in the axilla. When presenting your findings on auscultation, are breath sounds present, reduced, or absent? Specify where the changes occur. Are they normal vesicular or bronchial? And are there any added sounds such as wheeze, crackles, or rubs? Remember your anatomy. Do not listen over the spine or over the scapulae. Listen over the same areas for vocal resonance. Can I get you to repeat blue balloons? Every time I do myself. Go.
Blue balloons. Blue balloons. Blue balloons. Blue balloons. Blue balloons. Blue balloons.
Blue
Blue
balls.
balloons. Blue 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 balloons.
Thank you.
Intercostal spaces. Also from the scapula also. So we're checking for the tone and what are the normal tones of your lung fields.
Resonance.
Last is your soft intensity, high pitch, short duration, or mostly we can hear at the bony type or large pleural effusion. For the dull, is a medium intensity, medium pitch duration. So we can usually hear your dull sound in your liver. Auscultate. So that's for your diaphragmatic excursion. So for diaphragmatic excursion, the normal inch is your 3 to 6 centimeter. For the diaphragmatic excursion, first, for the, I know we should start in your,
Scapula.
The scapula when you percuss. For your diaphragmatic naman inhale kita. Percast, pakadto diri sa inyong sternum. Then, diri naman tama from your second intercostal down to your mid-sternal. Then for this one naman niya, start from your second intercostal, percast down to your fifth intercostal spaces. So the normal is 3 to 6 centimeter.
Batian mo gid ko.
Kali mo sa si Sir Sam. Diaphragmatic.
Amen. Amen. Magpiyong siguro dahil may kakita sa kanya.
From my mentor, so this upper cast, diri sa mid-sternal, percast. So diri sa atin nga second intercostal space, sa mid-clavicular nyo, you should percast, and you hear the dullness sound. When you hear the dullness sound, you have to mark. Then, next natin is...
Okay, listen. Diaphragmatic portion.
Dapat meron.
First, listen. Eyes on me. Listen. Diaphragmatic portion. First, you have to let your patient exhale. Hold. On the mid-clavicular, you're going to percuss on the second intercostal space going down. What you're going to hear a sound? Is it resonance, hyperresonance, or dull?
The resonance.
Resonance. Here. Resonance, dull. Mark. Why dull? Because
Diaphragm.
of the diaphragm. Listen, the diaphragm moves when you inhale and exhale. When you exhale, the diaphragm goes
Relax.
up or down.
Down. Down.
Inhale.
Up.
Gahabok pag ganyan yung ginagawa sa diaphragm.
Gapdalong.
Down.
Ay, sorry lang.
Kung mag-exhale ka naman niya, gagamay si lungs, hindi ka sa diaphragm.
Gadako.
Clear? Again.
Sorry.
Imagine, you have your lungs here, the diaphragm will go. You inhale, the diaphragm will go
Down.
You exhale, the diaphragm will go
Up.
Okay, very good. Clear?
Clear.
Okay, let's go back to the permanent portion. Starting from the second intercostal space, you have to let your patient exhale.
Exhale. Hold.
Hold, very good. Resonance. Dull. That's where the diaphragm is located.
Mark.
Then let the patient inhale, exhale, inhale again, and hold.
Inhale, sir.
Hold the neck. Hold, pagkatapos, percuss, dull. Gets? So you're going to assess the level of the diaphragm. Normally, it is around
3 to 6 centimeters.
3 to 6 centimeters. So ganyan lang i-assess the diaphragm. Okay. Remember that your lungs has a space. That is what you call your parietal space. If the parietal space has water, do you think your lungs can expand?
No.
Oh. When you perform inhalation and exhalation, does the diaphragm moves? Or the diaphragm can move? Yes or no?
Yes. No.
They can expand the lungs, the diaphragm. So
Oo.
that's one of the assessment where you have to perform different microexposure.
Tumitubig.
The other one is atelectasis, wherein kung sa ilunggo, panataktak ang baga. Taktak ang baga because of infection. No? And this is, the lungs cannot inflate and deflate. So if you need to assess the diaphragm, you cannot locate for the dullness because it's steady na hindi sa kanila. So different
Di ba, ano ka
is
ginawa?
very important. They said, sir, sa isa na naman kapag free-form. Yes or no?
No.
No, because you have two lungs. There will be conditions wherein the right lung can expand and the left lung cannot expand. So you have to perform it both the left and right lung. Here,
Kung ga-expand yung isa, so
tandaan
wala.
ang dullness.
Diaphragm.
You have to mark it. A change in sound could consider a problem. Because normally, this area is resonance. Here, okay. By the way, hyperresonance is in the upper or lower part of the lungs.
Upper.
Saan ako nung tayo? Hyperresonance.
Lower.
Okay, sorry. Hyperresonance in the upper.
Child.
Resonance is in the lower. And so, sama na sa...
So, ano naman niyo, sir? During the diaphragmatic excursion, you have to ask your patient to
Exhale.
Inhale, exhale. So first is
Exhale.
exhale. So from the second intercostal, you have to percuss resonance
Dull.
until you hear the
Dull.
dullness sound. Then when you hear the dullness sound, you have
Mark.
to mark. Then you have to ask
Inhale.
your patient naman to
Inhale.
inhale. So when you inhale,
Percuss.
hold, percuss,
Dull.
until you hear the
Dull.
So the two mirror or the two mouthpieces is your
Measure.
So what is the normal?
3 to 6
3 to
centimeters. Mga galing. Okay.
So in percussion, discuss na naman na kanina. So you have to percuss in the intercostal spaces, not the bony.
Bony.
Because you cannot hear any sounds in the bony
Flat.
of your back.
Video naman.
Percuss the posterior chest, starting with the supraclavicular fossa over the apex of the lung. Next, percuss the capitals directly. Percuss in an S-shaped pattern, which compares left to right and upper zones to lower zones. If you have not already done so when examining the anterior chest, percuss two areas in the axilla.
Ay, yun na yun.
So dito siya una ng percuss.
Scapula.
Charis.
Charis.
Sa scapula, no, may area na siya the hollow part. So, di ba, hindi ka pwede sa bone mag-percuss.
Percuss.
So, hindi sa may hollow part, you have first to percuss that one. So, ano ang bato kanina? Sa baba is your hyperresonance or resonance?
Hyper.
Resonance.
Sometimes it is important to determine the level of the diaphragm and whether it moves with inspiration and expiration. The easiest way to check this is to have the patient exhale completely and hold it, while you quickly percuss the dominance to determine the location of the diaphragm. Mark the location with a pad. Then allow the patient to take a few normal breaths, and then take a deep breath and hold it while you percuss to the level of the diaphragm again. Mark the spot with a pin also. The distance between the two levels is normally about 3 to 5 centimeters, and may be reduced by certain disease
Uy,
states.
so yun.
But what I'd like you to do is go ahead and take a deep breath and exhale it all and hold it.
Marvin. Ano to?
Go ahead and take a breath, Martha. Now what I'd like you to do is go ahead and take a couple of normal breaths, and take a deep breath and hold it in.
Sagot sila mong percuss.
And this distance is about 4 centimeters, which is normal.
Okay. That's not the diaphragmatic excursion. So you have to check for that sound of dullness.
Yes.
Your resonance sound. So percuss, then until you hear the dullness sound. So you have to check for the space using your ruler. So what is the normal?
3 to 6 centimeters.
Is the normal diaphragmatic excursion. So 2 lungs man ang inyo check or pihaka, hindi pwede 1 lang. So what is first? You have to inhale or exhale?
Exhale.
Exhale. The second is?
Inhale.
Then hold. Posterior. We're done with your posterior. So, next naman natin is green naman sa atubang na kaligtaan. So, ang next after we check for the diaphragmatic excursion, we have to auscultate the posterior lung field. So, same Japon as Japon. So, in auscultating, you use your
Stethoscope.
For this area, what part of the stethoscope you're
Valve.
For that, next one is your
Diaphragm.
diaphragm. So, assess the voice sounds naman natin. So, after you auscultate, you have to check for the voice sound. So, when assessing for the voice sound, you have to ask your patient to say
This is
99, 1, 2, 3, or E sound.
E
Because
sound,
we're
E
checking for
sound.
the
Vibration. Ano yap? Pero i-auscultate na. Likat pa, ginapagpit lang.
So there are abnormal breath sounds. So what are they? So rungkat, a continuous low pitch rattling lang sounds that often resemble like snoring. So ganun mo? Anong snoring?
Nagoragok.
Gawarago. Occur when air tries to pass through.
Lulubong.
And listen to your breathing. So, you take some deep breaths in and out through your mouth. Start by listening over the episodes with the valve. Switch over to the diaphragm. Move in an S-shaped pattern so that right is compared to left and upper compared to lower regions. Listen over the same areas you discussed.
Good.
The episodes 4 to 5 areas down the chest and 2 areas in the axilla. When presenting your findings on auscultation, are breath sounds present, reduced, or absent? Specify where the changes occur. Are they normal vesicular or bronchial? And are there any added sounds such as squeeze, crackles, or rubs? Remember your anatomy. Do not listen over the spine or over the scapulae.
Lulubong.
So when auscultating, you have to tell your patient to inhale, exhale while listening to your stethoscope.
Din ka pa S.
Sino na natin yan from percussion, after auscultating, you have to
S.
do the S pattern. Inhale, and down, next, down, next. So 3 is 5 na di siya because we start from this area, then second intercostal, next natin, pag isa likod, then sa lateral natin. So ano naman ang mga normal sound natin? What are the
review series of the lungs. I'll be doing a video on abnormal lung sounds as well as a lecture and skills demonstration video as part of this series. So let's get started.
Wala niyo mo. Wala rin yung mga sound.
Mas high to ang
Do tudo.
do listen.
Okay, thank you so much for watching. Remember, you can go to our channel to find more videos on nursing skills, wheezes, stridor, crackles, and floor friction rub. This will be part of a review series of the lungs. Also, be sure to check out the video on normal lung sounds as well as a lecture and skills demonstration, which is part of this series. So let's get started.
Look. May tawag. Ito na high pitch. Tapos, wet bump mixer.
Okay, thank you so
For checking for the anterior chest, we have to inspect for the symmetry of the thorax, ribs, and clavicles. When expecting, you have to use your eyes. And checking for the symmetry of the thorax, ribs, and clavicles. Then next is you have to inspect the skin color, your lesions, your hair distribution, and know with width of costal angle. Yun ang width of costal angle natin makita.
Grabe
This
mga
one,
baga.
separate. So, this is your width of costal angle. Ang dili pala sa dalong, your last ribs, then, i-hurry lang diba, angle na ako na siya, ho. So, that's the width of your costal angle. So, the normal width for your costal angle is 90. So, 90 siya ang normal width for your costal angle. Next, you have to assess the respiratory rate. So, when checking for the respiratory rate, di nyo siya tulungan sa inyong patient.
Sa abdomen.
Sa abdomen. Because dapat wala ka ba si patient na gina-check niya ang iyang respiratory rate. For your depth and symmetry, so sa symmetry, di naman nila sa chest nyo. Pero for the rate, sa abdomen na siya i-check. Maintain yung abdomen. So, dapat ma-check kung ginamit sa case, when you tell your patient that you're checking for the respiratory rate, na siya anxious na sa, so, sigasigon niya na inhawa. So, dapat, when checking for the respiratory rate, after you check the pulse, diba, you're checking the pulse, then,
Respiratory.
don't tell your patient you're checking your respiratory rate para hindi siya mag-anxious
Mag-manipulate.
or magdasig-dasig ginhawa. So, for the anterior chest, same lang nasa posterior kag anterior ha. You have to palpate the anterior chest. Palpate. Then assess for symmetrical chest expansion. What is the normal symmetrical chest expansion?
5 centimeters.
5 centimeter. Hintayin nyo rin mabutang sa atin yung kamot.
Sa coastal.
T9 or T10 na intercostal natin. Then,
T9, T10.
mag-inhale na natin expansion to 5. Then, pag-exhale niya, dapat na balik siya yung mga thumb. Then, assess for tactile primitus. So, you have to tell your patient to say 99 or blue moon. So, you check for the vibration. So, diri tama sugod because diri ang atan nga mga sound na matihan sa atan nga intercostal spaces. So, after this one, scapula, then your second intercostal space. Then, percuss the anterior and lateral chest. So, percuss yung gani. Same man Japan na, this one. We have to percuss. What sound will I hear when I percuss this area?
Resonance. Dal.
Hyper
resonance.
Then resonance. S man Japan, S ang atong ganito. Then,
As-
auscultate for the trachea, and then clear and lateral lung fields. Where is your trachea? This one. So, you have to auscultate starting from here. Ha?
Basta
Then
din,
next,
miss.
This, dili ayun.
Tapos?
Then next, dili sa atin nga, intercostal. Then, same Japan. S, S, S. Then next, assess for voice sound. When assessing for the voice sound, what will you talk to your patient? Say 99. Then assess for the vibration.
Hard naman sa... Magtas mo sa... Uy, sa kambal.
The examination of the anterior chest is often the primary focus of an ostomy. Start your exam with general inspection and then move on to closer inspection. You may more clearly see skeletal abnormalities, scars, asymmetry of chest wall movement, or the swelling of subcutaneous emphysema. I'm just going to compress your rib cage, if that's okay. This assesses for any rib trauma. If there's a fracture or bruise, the pain localizes to the affected area. And I'm just going to feel for the placement of your heart. Palpate now for the apex beat. This is the most inferior lateral point where the pulsation of the heart is palpable. When it is found, identify its anatomical location to determine if it is displaced. It should be located in the fifth left intercostal space on the midclavicular line.
Ito na rin ang nipple.
So Dara, I'm just going to put my two hands on your chest. Dara, I want you to take a deep breath in and out through your mouth. This assesses symmetry of chest wall movement. Okay, and another one. This assesses chest expansion. Thumbs should move symmetrically, and normal expansion is at least 5 centimeters. Your thumbs must meet at the moment of full expiration for an accurate assessment of chest expansion. So, can you get to repeat after me? Blue balloons.
Blue balloons.
And every time I move my
Blue
hand.
balloons.
May vibration.
This assesses tactile parameters. Position the side of your hand in the intercostal spaces to maximize sensitivity. Parameters is increased over consolidation, lower collapse, or solid masses. It is decreased over effusion.
Blue balloons. Blue balloons.
Thank you. So, you're going to tap around your chest. Percuss the anterior chest, starting by tapping directly on the clavicles. Move in an S-shaped pattern and percuss 3 to 4 areas. Try to align your static finger with the intercostal spaces for a clearer percussion note. Percuss 2 areas in the axillae. Percussion over lung is normally resonant. Consolidated lung and atelectasis would sound dull. Pleural effusion would sound stony dull. If the patient has a pneumothorax, the lung would sound hyperresonant. Next, you're going to listen to your chest. So, can I get you to take deep breaths in and out through your mouth?
Bell. Bell.
Start by listening over the ipses with the bell. Switch over to the diaphragm. Then move in an S-shaped pattern so the right is compared to the left and upper compared to lower regions. Listen over the same areas you percussed. The ipses and then 3 to 4 areas down the chest and 2 areas in the axilla. When presenting your findings on auscultation, are the breath sounds present, reduced, or absent? Specify where the changes occurs. Are they normal vesicular or bronchial? Are there any added sounds such as wheeze, crackles, or rubs?
Pause ko. Amo na gurong bell na nakapta. Wala man ako Iba may liso-liso na da. Pero
Okay,
ulan.
now posterior nyo kagla.
Jason, I'm going to listen to the chest. You can just take some deep breaths in and out through your mouth.
Kasi kayo, hindi kayo dumitaw. Hindi, sample lang.
Tapos lang siya, 27 items lang siya.
Wow.
Diba? 27.
Sulit lang, pareho lang ang likod, pareho mo ng tubang.
Sige, send ko na lang sa teams nyo is